Hi, I'm Randy with ReportMaster Incorporated. Welcome to this week's edition of Business Builders TV, where we share with you information from experts in the industry to help you build your practice. Today we have Jim Miller with us. Jim is the CEO of EP Management. It's a consulting group for chiropractors. They've been in business for over 15 years, and he's helped several thousand chiropractors in the U.S. and Canada. And he has some very valuable information, and we're lucky enough to actually have him here and to be able to share his information with our viewers. Hi, Jim.
Hi, Randy.
Welcome.
Well, thanks for having me here.
All right. So what would you like to tell our viewers today?
I want to talk about treatment plan acceptance.
Okay.
As you mentioned, as we were talking before doing this, that the economy is not in the greatest shape, right?
Mm-hmm.
Randy, what would you say are the most common objections doctors run into when getting a patient to accept treatment?
Oh, gosh, probably time and money.
Absolutely. Okay. So what I'd like to give your viewers is a few little key tools that they could use to increase their treatment plan acceptance.
Yeah, great.
Okay. All right, good. One of the tricks is you have to actually increase the willingness or awareness of the patient that they have a problem. Okay. If you look at anything in life, when people really want something, it's interesting, but they'll always find the money for it.
Right.
Okay.
Yeah.
You see that with women buying, $500 purses, to men buying radios and spinner rims for their car, shotguns, trucks, etc.
Yeah.
Okay. So when we're doing a consultation on that first visit, it's really important that the patient, they themselves, realize that they got a problem. Not the doctor telling them they got a problem.
Right.
Okay.
That makes sense, yeah.
Absolutely. So one of the little tricks is, or helpful tools, is not minimizing the problem, maximizing it.
Ah.
Right? So the patient goes, oh, I've had headaches for a number of years. We don't go, okay. Now we go, wow.
Right.
That's not good. How many years?
Yeah.
You have to maximize and make it more real.
Yeah. Because they've been basically saying they've been kind of going along thinking it's not that bad.
That's right.
Yeah.
Headaches might be common, but doesn't mean it's natural.
Yeah. And really, it could be something pretty serious, right? I mean,
absolutely.
It indicates there's something wrong with them.
Correct.
Yeah.
Correct. I mean, that's the way the body's trying to tell the patient something's not right. And they keep blowing it off and taking their medications, Tylenol, Advil, etc.
Right.
So we have to maximize it. We have to really impinge and not let them get away with making excuses. Patients are really good at making excuses. Okay.
Yeah.
It runs in the family. It's always been that way.
Right.
Learn to live with it. Well, we got to nail the patient on that. Learn to live with it. Wow, that's not okay.
Yeah.
What would life be like if you didn't have these headaches? Okay.
Yeah.
Right. What are some things that you've tried that have not worked? Would be another good question.
Yeah.
Notice the key word, not worked.
Right. Right.
Because if they keep taking Tylenol 3 times a week, is it really working?
Not at all.
No, because it keeps coming back, right?
Right.
But you have to speak to the patient in a way that it's real to them. So like analogies are another big helpful tool to use. If you had to keep taking your car to the mechanic every other day, would you say you fixed your truck?
No, not at all.
Absolutely.
Yeah.
So, when someone's saying they take Tylenol, you have to kind of impinge on them. That it's like, what, have they got a deficiency of Tylenol in their bloodstream?
Right.
Yeah. So maximizing and kind of nailing and getting the patient to take some responsibility for their problem is huge.
Yeah.
The last tool I can give you would be getting them to realize it's not going to get better by itself. So if we look at it scientifically, nothing stays the same in this universe. Things either get better or worse. Right? And you know that in your practice as well, that nothing stays the same.
Right.
So when we get to that point, we have to ask that question. It's like, well, Randy, if you've had these headaches for 5 years and it continues on for another, let's say, 6 months, how much more worse do you think it's going to get?
Oh, gee, I guess it could get worse. Yeah.
Absolutely.
In fact, it is getting worse. I mean, a guy would probably say that, right?
They actually do say that because when they've taken a look at it, they had this from a number of years. Well, what was it like a couple of years ago, and what's it like now?
Yeah.
Okay.
Yeah. And I would think a guy might say, well, is there a way to get rid of it?
Absolutely.
Yeah.
And what we're going to do is do an exam and X-rays to see if we can help you. But that's basically what you want to hear from the patient, that they recognize, wow, this isn't okay, or I have a problem, or can you help me? That means now they're willing.
Yeah.
But if they're just going along for the ride, then we didn't do our job of raising their willingness or awareness.
Right. Wow, that makes a lot of sense.
Thanks, Randy.
Well, thanks for that.
You're very welcome.
Yeah. And Jim has written a number of things highly valuable to chiropractors, and he's actually providing one particular report for free with some very, very important information that can help you in your practice. If you actually would just do the survey, there's a button on this email you receive from us, a button you click for a survey, fill out the survey, and you get a free copy of Jim's report. And I want to thank you for watching, and we'll see you next time. And Jim, I want to thank you for coming.
You're welcome.
I really think this is some very, very important information that can help our clients.
Well, thank you.
All right.